Hello, my name is Allison Warner. I am the Chief Editor of Orthodontic Products. Thank you for joining us for today's episode of In the Sterilization Room with Jackie, where we talk to infection prevention expert Jackie Dorse about what you need to know to keep the orthodontic team and patients safe during the COVID-19 pandemic and beyond. For over 30 years, Jackie has been a consultant specializing in instrument sterilization and infection control and prevention in the dental setting. She has degrees in microbiology and dental hygiene and has been a featured speaker at the American Dental Association and the American Association of Orthodontists. Jackie, it's nice to see you again this week.
It's wonderful to see you again, Allison. And as usual, we always have new information that has been published for us to discuss. One of the big events with this week is that the American Association of Orthodontists decided for their Boston meeting to be a virtual meeting rather than a live meeting, as everyone was hopefully anticipating. So some big changes there, but there's also other significant sterilization information. That's the title of our presentation, In the Sterilization Room with Jackie, that has been released recently that I think will be helpful to all of the viewers to learn about the details.
Yeah, exactly. So there was a news story that came out a couple weeks ago, and so we're going to talk about that today. And it's a recent settlement involving the orthodontic department at Nova Southeastern University in Florida, and it's a class action settlement for $5.5 million. So, Jackie, what happened here, and how does this affect sterilization?
Well, the university's orthodontic department was involved in a class action lawsuit that involved 1,152 patients. And the lawsuit was brought against the school because those patients had been treated with handpieces that were not sterilized, but had just been surface disinfected from 2015 to 2018.
Oh, wow.
And that did not meet the standard of care or the CDC guidance for sterilization and infection control. And again, it was a settlement. The school was not was not confirmed with wrongdoing on it. And of course, so and changes have been made obviously with it. But this is one of the largest financial settlements that I've seen that involved sterilization. And handpieces, when they're used in a dental or an orthodontic practice, after each patient use, they should be removed from the air-water connector with it and cleaned and then packaged and sterilized before use on the next patient. And as the settlement stated in here, bear with me if I read from the publication or the announcement on it, and it says at the university's main campus, they did not follow Centers for Disease Control guidelines for infection control requiring heat sterilization of dental and orthodontic equipment. Instead, between July the 15th and February 2018, they wiped down those instruments with a disinfectant. So, and then further it went on to make a statement in here. Well, why did they do that? Why didn't they why didn't they sterilize those handpieces?
Right, exactly.
And one of the attorneys, the comment in that he listed in there was from Jay Cohen. He said, this happened because they were booking multiple procedures at the orthodontic clinic and the students were not capable or able to adequately sterilize for the next patient. They were sanitizing, not sterilizing. They knew about it for many months before it was even disclosed to the patients. And I remember I received a copy of the letter that Nova Southeastern University sent out to patients, notifying them that there may have been a slight risk, and it's minimal. There really is not a huge risk of acquiring a bloodborne pathogen from a handpiece that would be used in an orthodontic procedure, but it's still the standard of care for sterilization, for infection prevention, and that's what we should adhere to. And it takes about a 2-hour processing time, really, to clean and package and sterilize a handpiece. And the students had limited number of handpieces, it seems. And if they had another patient scheduled that they might need a handpiece for, within that period of time, and they didn't have time to take the instruments to central sterilization at the school and then wait for them to process them and get them back, then out of to be able to accommodate their schedule, they would wipe down those handpieces and sanitize the exterior and reuse them again. And I've seen this happen in private practices also, because handpieces are expensive. You don't always have an adequate inventory to be able to put those handpieces through the 2.5 hour process. And it's not that it takes 2 hours for the sterilizer to sterilize them. It's involved in the actual purging of the air, sanitizing or cleaning the exterior of the handpiece, putting the handpiece into a sterilization pouch, then running it through the sterilizer and waiting for it to dry, for that pouch to dry, and then remove it, and then it's ready for the next patient use. And on average, with all of the other tasks that the orthodontic assistants may be doing, and it will average being a 2 hour process. So they do need to have an adequate inventory of handpieces, and not having enough of those, that's where you compromise sterilization.
Okay. So what is the CDC guidance then?
Well, CDC states they published a wonderful one-page document to clarify for dental professionals on what you should be doing for sterilizing handpieces. And in that document, CDC states that with each use, the handpiece should be removed from the air-water connection. All devices that are connected to air and water at the dental unit should be removed, cleaned, and sterilized with it. And they actually put together a 3-point bullet point box and on that web page document that's listing how to sterilize the handpieces. And number 1 says clean and heat sterilize handpieces and other intraoral instruments that can be removed from the air and water lines of dental units. Number 2, for handpieces that do not attach to air, water, and water lines, use FDA cleared devices and follow the validated manufacturer's instructions for reprocessing these devices. So it's very important for the orthodontic office to have the MIFUs, manufacturer's instructions for use, for each one of the types of handpieces they have. They may have several different brands. They may have a Sycan handpiece and a Cavo handpiece and a Star handpiece, and each of those manufacturers can have unique specifications for cleaning, packaging, and even the time or the temperature for sterilizing those handpieces. And you have to follow the manufacturer's instructions for all equipment. And then finally, number 3 in the bullet point box is if the dental handpiece cannot be heat sterilized and does not have an FDA clearance with validated instructions, then for reprocessing, do not use that device. So that becomes a single-use device. And you may think, well, why did CDC even state that? Unfortunately, a few years ago, we had a time that some orthodontists found handpieces on eBay that were $15 a piece, and they were sold as single-use handpieces. But with not having any MIFUs, manufacturer's instructions for use, there were a few offices that tried sterilizing them and reusing them. And those handpieces did not hold up to the process. And as a result, the chuck that holds the burr would get loosened. And there was even one incident of where a burr fell out in the patient's mouth while the doctor's using it. So that becomes a hazard or a risk. That's why the Food and Drug Administration clears medical and dental equipment, that it's safe for use and will not cause injury or harm to the patient as we're providing care to the patients. And again, that's why those same instructions for use are cleared by the FDA, and we're required to follow those.
Oh, okay. All right. So how often are handpieces used in the orthodontic clinic? Is it more than just in debonding appointments these days?
Well, you know, years ago, before we started using some of the very, I'm going to say, strong adhesives, like, and I'll refer to them as like a glass ionomer cement, and there are a number of chemical variations on them, but those strong adhesives, those bonding agents, that's what prevents breakage and having the patient lose a bracket with it. Well, you can remove, if you're going to remove the brackets, say at the end of orthodontic treatment during the debond procedure, then often the orthodontic assistant will remove the brackets using a debond plier. And that'll just, detach the bracket, but it leaves some of that residual adhesive. And the only way to effectively remove that and leave the tooth with a really smooth surface or a rebondable surface is to take a high-speed handpiece with a finishing burr on it. And that's how you remove that adhesive on it. So handpieces, they can be used not just at the debonding procedure, but if the doctor needs to be repositioning a bracket. And I'm seeing that happen frequently. Maybe the tooth is not moving in the direction that was anticipated with it. It may even be compliance from the patient or even a patient habit that requires an adjustment of that bracket. So just to reposition one bracket, they're going to need a handpiece. So I'm seeing more and more frequently that handpieces are used with patients, and it's not just with braces. They have to use a handpiece, say with aligner patients, if they have to put a button on or remove a button. Then that's going to require a handpiece. So my rule of thumb is it's going to vary from doctor to doctor because some doctors reposition brackets more frequently than other doctors. But the rule of thumb would be 2 handpieces per chair plus 2. And if the assistants find that, hey, we still are running short on handpieces, then you might have to increase that inventory. And fortunately for orthodontists, we don't need the super ultra expensive handpieces with the fiber optics on them and all of the bells and whistles. A simple handpiece. I know some orthodontists will use their handpiece and they don't even have water going through the handpiece because it's such a short amount of time that they use it on the tooth. They don't see the heating that can come when you're not using water spray as a coolant with it.
Okay. Well, you talked about what the CDC guidance is, but what is involved in the handpiece sterilization process?
Well, as I talked about, each manufacturer has their specifications with it, and I pulled up a one-page just to give an information from SciCan. This is the information they provide on how to reprocess their handpieces, and it's a very direct, provides all of the details that are needed and pictures. We all love to instructions to include the pictures with it, and so once the handpiece is removed from the air-water connection at the unit, the exterior needs to be cleaned. Different manufacturers will recommend soap and water. Some will recommend an alcohol wipe with it. Most manufacturers do not recommend using a disinfectant wipe, and I see that done a lot because that disinfectant wipe can leave a detrimental chemical on the exterior of the handpieces. So again, go back to your handpiece manufacturer's instructions with it. Then after it's been cleaned with it, you have to clean the interior of the handpiece. There's an open airway that air flows through to turn the turbines inside the handpiece. So you put a cleaning chemical inside, reattach it to air, and blow that cleaning chemical through the handpiece. Then and a burr should be in the handpiece according to most manufacturers' instructions, or a blank as they're referred to during that process. Then after you clean, if the handpiece manufacturer indicates lubrication, then you would apply lubrication, spray that in, and then reattach to air again and blow that through. One of the big time savings and standardization, it really improves the performance of the handpieces, is to use an automatic handpiece cleaner lubricator. There's like a Statmatic, or I know Cavo also has a automatic handpiece cleaner lubricator, and they can quickly do the cleaning and the lubrication of these handpieces, 3 of them at a time, in less than 1 minute. Oh, what a huge time savings that is for it. So after they're cleaned and lubricated, now you place it into a sterilization pouch. Then it's ready to go into the autoclave Handpieces are autoclaved, and then after it is autoclaved and you go through the drying cycle time, then the handpiece is ready to be removed. When it naturally cools down, don't try to speed up the cool down process if it comes out of the sterilizer hot by running cold water over it. That's a bad practice that was started many years ago, and that can actually cause damage, that quick cooling to the handpiece, and it can shorten the life of the handpiece. And it recontaminates the handpiece because water coming from the faucet is not sterile. It can have up to 500 colony forming units per milliliter. So then after the handpiece cools down, then it's ready to use.
Okay. Well, Jackie, I think this information is really helpful and reinforces best practices. I know we actually touched on this topic in a previous episode, and I'm trying to remember which one.
You're right, Allison. Way back last year in 2020, about May, episode 5.
Okay.
We went into all of the details, and I even held up a handpiece and showed how to correctly place it into a sterilization pouch. And we went through all of the specific details. So I think for any office that needs to do a refresher, looking at episode 5, it's available on the Orthodontic Products website. And you've even put it openly up on YouTube. For them to access with it. So
a little link up here in the I guess upper left-hand corner for anybody who needs it. So
very good. There's a wealth of information throughout all of our episodes in the sterilization room, from designing the sterilization room to ultrasonic cleaning to sterilizing handpieces.
Exactly. Well, thank you so much, Jackie. Check back soon for the next episode of In the Sterilization Room with Jackie. In the meantime, to catch up with past episodes or to check out the latest orthodontic industry news, visit our website at orthodonticproductsonline.com. Until next time, take care and stay safe.
Be safe and get vaccinated.
Definitely. All right. Thank you, Jackie.